All right, today we're doing a deep dive into one of the most potent and most important drugs you'll ever encounter in clinical practice, fentanyl. We are going to cover everything you as a student need to know, from how it works on a molecular level all the way to using it safely at the bedside. Let's get into it.
So let's start with a scenario. Picture this. You've got a patient in a ton of pain after surgery, but you check their chart and see they have chronic kidney disease. Now you know that a lot of opioids like morphine are risky here because their metabolites can build up and become toxic. So what's the move? What do you reach for? This exact situation is why having a rock-solid understanding of fentanyl is absolutely non-negotiable.
So here's our game plan. We're going to take this journey from the lab bench straight to the bedside. We'll start with the basics, then get into how it works, the risks you got to know, and the key clinical stuff. And we'll wrap it all up with a high-yield pearl for your exams. Okay, first things first, what exactly are we talking about here? Let's nail down its basic identity and what we actually use it for. At its heart, fentanyl is a synthetic opioid analgesic. And the word to lock onto there is synthetic. This isn't derived from a plant like morphine. It's completely man-made in a lab. And its job, its therapeutic class, is simple. It's a painkiller, an opioid analgesic. And this number, well, this is all about sheer power. Fentanyl is anywhere from 50 to 100 times more potent than morphine, which has been our gold standard for, forever. This incredible potency is what makes it so incredibly effective, but it's also the very reason it demands our absolute respect and caution. So where do we use this heavy hitter? Well, it's a workhorse, really. It's for severe pain, both the kind that hits you fast and the kind that sticks around. In the OR, it's a key player in general anesthesia, and it's used to stop that dangerous surge in heart rate and blood pressure when a breathing tube goes in. And bringing it full circle back to our first question, it's one of our go-to drugs for managing pain in patients whose kidneys are failing. So we know what it is, but how in the world does it actually shut down pain on a molecular level? Let's look under the hood. The main target here is something called the mu-opioid receptor. You've got these all over your central nervous system. The easiest way to think about it is like a lock. When that lock is activated or turned, it stops the release of all the little messengers that are trying to scream pain to your brain. Fentanyl. Well, fentanyl is the key that fits that lock absolutely perfectly. And here's the kicker. Fentanyl isn't just any key. It's a master key. It's what we call a full agonist. That means when it binds to that mu receptor, it doesn't just turn it on a little bit, it cranks it up to the max, giving you the most powerful pain relief possible. It just slams the door shut on those pain signals.
Okay, the key is in the lock and the pain signals are blocked. But what about the drug's journey through the body? Let's talk pharmacokinetics. You know, the whole ADME process: absorption, distribution, metabolism, and excretion.
When you give fentanyl through an IV, it is incredibly fast. We're talking you'll see it start working in just 1 to 2 minutes. It hits its peak effect in about 15 to 30 minutes, and the pain relief lasts for about a half hour to an hour. This fast on, fast off profile is exactly what you want in acute situations where you need control and you need it now. And here's the whole story. It's absorbed super fast. Because it's really fat soluble or lipid soluble, it zips right across the blood-brain barrier to get to work. But this part right here is the golden ticket for our patient with kidney problems. The liver breaks fentanyl down into metabolites that are inactive. That means there are no toxic byproducts floating around that can build up if the kidneys aren't clearing them properly. This is what makes it so much safer than morphine in renal failure. Okay, we've seen the power, we've seen the benefits. Now we have to talk about the flip side of that coin, the risks. It's absolutely crucial to know when to hit the pause button and what dangers to be on the lookout for. You need to have these red flag patient groups practically tattooed on your brain. For someone with a head injury, the respiratory depression from opioids can make intracranial pressure skyrocket, which is a disaster. In a trauma patient who's lost blood or has low blood pressure, it can make them crash. You also have to be extra careful with the elderly, with patients who are already on opioids and have a high tolerance, and of course, anyone taking other drugs that slow down the brain. So here are the side effects you're going to see. You've got your usual suspects. People get sleepy, nauseous, constipated, maybe a little itchy. But it's the life-threatening stuff that you have to be able to spot from a mile away. The big one, the one we worry about most, is respiratory depression, breathing that slows down or stops completely. And then there's this other really unique and scary reaction called rigid chest syndrome. And let's just really hammer this point home. If you push a high dose of fentanyl too fast, it can cause this rigid chest syndrome.
The muscles of the chest wall literally seize up. It can get so bad that you physically cannot ventilate the patient, not even with a bag mask. This is a true code blue emergency, and you need muscle relaxants on board immediately to fix it. So with all that in mind, how do we actually use this drug safely at the bedside? This is all about the practical stuff, what you need to be watching for and what you need to be telling your patient. Think of these as your non-negotiable safety checks. Before and after every single dose, you're checking their breathing rate and their O2 sats. You're constantly checking their pain level and how sleepy they are so you can give just enough but not too much. You're keeping an eye on their blood pressure. And maybe most importantly, you always know where the naloxone is. The reversal agent has to be ready to go, just in case. Now, a massive part of being a great clinician is communication. So how do you talk to your patient about this incredibly powerful medicine in a way that helps them understand and partner with you in their own safety? You want to hit these 4 key points. First, set the expectation. This is strong medicine, and we're going to be watching you like a hawk. Second, safety. This can make you sleepy and dizzy, so please call us before you even think about getting out of bed. Third, empower them. Tell us if you feel sick to your stomach, itchy, or if it feels weird to grease. And finally, be specific about the scary stuff. It is super important that you tell me right away if you feel any tightness in your chest. All right, let's wrap this up with my favorite part, the clinical pearl. This is that little nugget of high-yield info that's perfect for your exams or for when you want to look extra sharp on rounds with your attending. So here it is. This is a huge difference between fentanyl and morphine. Morphine can cause the body to release a bunch of histamine. That histamine makes blood vessels dilate, and what happens when blood vessels dilate? Blood pressure drops. Fentanyl doesn't do that. And that difference is a really big deal in practice. Because fentanyl doesn't dump a bunch of histamine, it's way more hemodynamically stable. This makes it a much, much better choice for a trauma patient, a patient in shock, or anyone whose blood pressure is already shaky. You get that powerful pain relief without crashing their pressure. That's a huge win. So I'll leave you with a question to chew on. You've seen the good, the bad, and the science of this drug. As you move forward in your career, start thinking about that dual nature. Where is fentanyl going to be an absolutely indispensable tool in your kit? And on the other hand, in which situations are you going to treat it with the most extreme, profound caution? Getting that balance right, that's the key to mastering this powerful medication.